Good afternoon, thank you for joining us. I'll give you some warning in advance. My update is going to be slightly longer than normal today because I've got a few updates that I want to cover. I'm also going to touch a little bit on Christmas, which I know is of huge interest to everyone. But firstly, as usual, I'll cover today's statistics. There were 689 positive cases reported yesterday, which is 5.9% of the total number of tests, and means that the total tally of confirmed cases now is 108,438. 140 of today's new cases were in Lothian, 109 in Greater Glasgow and Clyde, 92 in Lanarkshire and 91 in Ayrshire and Arran, and the remaining cases are spread across 8 other health board areas. 1,031 people are currently in hospital, which is an increase of 35 from yesterday. 49 people are in intensive care, which is 4 more than yesterday. And I'm sorry to report that 38 additional deaths have been registered in the past 24 hours of patients who first tested positive over the previous 28-day period. The total number of deaths under that daily measurement, therefore, is now 4,173. However, National Records of Scotland has just published its usual weekly update, which, as well as deaths of people who had been confirmed through a test as having COVID, also includes cases where COVID is a suspected or contributory cause of death. Today's update shows that by last Sunday just past, the total number of registered deaths linked to COVID under that wider definition was 6,092. 224 of those deaths were registered last week. That is 8 fewer than in the previous week. 154 of those deaths occurred in hospitals, 62 in care homes, and 8 at home or in other non-institutional settings. Now, the fact that the death toll under this wider measurement has now passed 6,000 is clearly another reminder of the devastating impact that COVID has had, and it is, of course, another very distressing milestone. Every single one of these deaths is a source of grief and heartbreak to a family somewhere across the country. So yet again today, I want to send my thoughts and my condolences to everyone who has suffered the loss of a loved one during the course of the pandemic so far. Now, in a moment, Dr. Steedman, the Deputy Chief Medical Officer, is going to provide an update on our vaccination programme. Before then, though, I have 3 issues I want to update you on as briefly as I can. The first is an issue I have to give an update on relating to the Protect Scotland app. And this is an update that is relevant to around 900 people who were advised by the app to self-isolate for 10 days and who received that notification between 1 minute past midnight on Monday morning and 8:30 a.m. on Tuesday morning. During that 32.5-hour period, we would normally expect, given current prevalence of the virus, around 250 notifications to be issued. Instead, 900 notifications were issued, and we have realised that this was because during an upgrade to the app, it was configured in an overly sensitive way over that period. I want to reassure people that the issue has been identified and has now been fixed, but it does mean that some people will have received notifications in that period who do not actually need to self-isolate. So this is a message to anyone who was notified to self-isolate between 1 minute past midnight on Monday morning and 8:30 on Tuesday morning. If you got that notification telling you to self-isolate, then please call the National Contact Tracing Centre. That's on 0800 030 8012, 0800 030 8012. That will enable you to speak to a specialised contact tracer to see whether or not you actually need to self-isolate. If you are one of the people who have been notified incorrectly, they will advise you of that. That's something I obviously felt the need to update people on today, but I want to end this update with an assurance that the app has been working really well at all other times. This was a one-off blip as a result of an upgrade to the app, and it has now been fixed. So if you have received a notification at any other time outside the time period I've just given there today, then please follow the app's advice as normal and self-isolate. Second issue I want to cover today is that Public Health Scotland has, as it normally does on a Wednesday, published a number of reports. However, today, some of those reports show the impact of COVID on school staff and young people. Obviously, we are very keen, partly to help reassure young people, parents and teachers about the safety of schools, that we understand more fully any impact on our schools. Now, amongst other things, and these are complex statistical reports that I know journalists and others will want to take a bit of time to consider, but among other things, they show that almost 2/3 of schools have not had any pupil cases of COVID. Now, as you might expect, that's an overall figure. The figure is different when we look just at secondary schools, where around 2/3 of schools have had recorded cases, and those figures are also different in areas where the level of prevalence in the general population is higher. However, even here, the reports show that the impact of COVID has often been relatively limited. For example, in the final week of the survey, fewer than 1/5 of secondary schools had more than one case of COVID. The data also looks in some detail at the impact on staff in schools, which I know has been and continues to be an issue of concern for teachers and other adults working in schools. Looking at the data since August, when schools reopened, what the report shows, amongst other things, is that there is no evidence of any difference in the risk of hospitalisation for teachers when compared to the general population. In fact, the risk of severe COVID actually seems to be lower in teachers than the population as a whole. And antibody test results for education staff were similar to the results for the general adult population. So taken together, and there's a lot more in these reports than the headlines I have just shared with you, and there will be detailed questions as people have the chance to consider these reports fully. But taken together, they are an important contribution to our understanding of how COVID is affecting students and education staff. And in my view, while of course we will continue to listen very carefully to the concerns of teachers and others, they support the view that it has been right for schools to remain open. But I hope the fact that we are ensuring that this kind of work is being done is also a demonstration of the fact that we are not complacent about the risks of COVID anywhere, and we want to properly understand what the impact is in schools and on pupils and teachers, so that that can continue to inform our thinking. And obviously what these reports do show adds up to a tribute to the vast amount of work that has gone into ensuring that schools can be open and be open safely. So the final point I want to make on this, and before I do this, let me say I don't want to and never will seek to underplay how difficult and stressful a term this has been for pupils, for parents and for all teachers, school leaders and staff. But notwithstanding that, I think the findings in these reports do underline what a very good and important job all of these people have done. So as we approach the end of this term, I want to take the opportunity to thank each and every one of them. I know this, for teachers in particular and others who work in schools, this has been a particularly stressful time, and my grateful thanks are with all of you. Now, Public Health Scotland has also released figures on our pilots for community testing, mass community testing of people who don't have symptoms of COVID, and they show that more than 15,000 tests of asymptomatic people were carried out in those pilots. 228 of these tests were positive. Those cases may not otherwise have been identified, so the pilots do demonstrate that asymptomatic testing can help us break chains of transmission, and we will be considering the lessons of these pilots as we expand asymptomatic testing in the new year and further into the future. Now, the final point I want to cover today, and I'm going to take a little bit of time on this, is arrangements for Christmas. I took part in Four Nations discussions yesterday and again this morning with the UK Government and the governments of Wales and Northern Ireland. And these discussions, the fact that they have happened, reflect that in parts of the UK, cases are rising again, and in some parts of the UK rising quite rapidly. Now, Scotland's case levels remain at the moment lower than in the other nations, but even so, we can't be complacent and we need to consider the evolving situation. We intend to issue updated guidance, we hope later today, and we hope that this will be agreed on a four nations basis. That is what we are currently working towards, and those discussions are continuing. So they have not, at the time I came down to do this briefing, concluded yet. But I want today, because I know there is an intense and understandable interest in this, so I wanted just to run through some of the principles that the Scottish Government is working on. Firstly, the pragmatic considerations that led us to agree some limited flexibility over Christmas have not gone away. We recognise that in some cases the isolation caused by being alone over Christmas will in itself cause harm to people's welfare. And we understand that some people will simply not be prepared to leave loved ones alone over the whole Christmas period, and perhaps especially on Christmas Day. I also recognise that some people will already have made plans for Christmas. And it's for those reasons that we decided across the four nations to give people some clear boundaries around the Christmas period, rather than seek to prohibit any interaction altogether, or on the other hand, risk everyone just trying to set their own boundaries. And on balance, we and I still think that is the right approach to take. So we don't intend to take away the flexibility. That, in my view, wouldn't be fair at this stage, and it wouldn't be realistic either. And indeed, it may risk undermining rather than strengthening compliance with the overall COVID guidance. However, we and the Scottish Government do intend to strengthen the guidance we give to people about whether and how they should make use of the flexibility. The guidance in Scotland is already a bit tighter than elsewhere, but we hope we can come to a four nations agreement on a clear and united message to the public. But let me be clear, not all of what I'm about to say right now is yet agreed with other nations, and of course I cannot and would not try to speak for them. But I wanted to set out for you the key elements of the advice that the Scottish Government has been and will continue to give over the period ahead. Firstly and unequivocally, the safest way to spend Christmas this year for you and for those you love is to stay within your own household and in your own home. And my strong recommendation is that this is what you should do, if at all possible. Any interaction you do have with another household should, if at all possible, be outdoors. But if you do consider it essential to meet indoors with someone from another household, you should limit both the duration and the numbers as much as possible. And this point I want to stress in particular. The 5-day relaxation is a window of opportunity during which you can meet. It is not a period that we think it is safe or sensible to get together for. You should see it as a maximum, not a target. My recommendation is that if you do form a bubble, you should not meet up with people in it any more than on one day over that period if possible, and you should not stay overnight unless it is unavoidable. You should also limit numbers as far as possible. 3 households is a maximum that tries to account for the fact that families come in all shapes and sizes, but 2 would be better. In short, if you have to form a bubble, keep it as small as possible. In Scotland, we already advised an overall limit of 8 people, and I recommend that you stay firmly within that if you do feel you need to form a bubble, and again, the smaller the better. And lastly, we will recommend against travel from high prevalence to low prevalence areas of the UK, and we'll issue more detail on that shortly. Also, as I stressed on Monday, if you are intending to form a Christmas bubble, you should already be trying to reduce any unnecessary social contacts. And this year, for most people, all of what I've just run through there will be the safer choices to make, and I would encourage everybody to think very carefully about that. If you haven't made plans to form a bubble yet, please don't. If you are still swithering, please decide against. And if you have made plans but think they're not really essential, perhaps think about postponing until later in the year. But if you believe your plans are essential, I understand that, but I'm asking you to follow all of the advice I've just set out. And please also follow the guidance on what to do when you are indoors. That means keeping safe distance as much as possible, washing your hands and surfaces regularly, keeping windows open, and avoiding eating from the same dishes. I know this is incredibly hard for everyone. I have to say I hate with every fibre of my being standing here trying to regulate how you spend Christmas. And I wish it was an easier or a more binary decision. Just let people meet as they wish or ban it altogether. But it is more complex than that. We are all human beings with human emotions, and we're all going through a really tough time right now, and no leader trying to encourage maximum compliance with restrictions can simply ignore all of that. But equally, I have a duty to reach the best balance we can and to be straight about what, within the boundaries of the law, we're recommending. The reality is that this Christmas simply can't be normal, but we have every reason to hope that next year's will be much more normal. So hard though it is now, let us all try to keep that in mind. We're just about to hear, after all, an update on the vaccination programme from the Deputy Chief Medical Officer, and that does give us real hope of being able to enjoy safer meetings with our loved ones in the not too distant future. And it means that for this Christmas, the best thing we can all do is help keep our loved ones as safe as possible. And of course, between now and Christmas and then after the Christmas period, we should all stick to the current rules and guidelines. If you're in any doubt about what they are, use the postcode checker on our website. But outside of island communities, nobody should be meeting in other people's houses just now. If you do meet other households outdoors or in indoor public places, the limit is 6 people from a maximum of 2 households. Try to work from home when you can. Download the app, avoid car sharing, and remember facts. Face coverings, stay away, avoid crowded places, clean your hands and surfaces regularly, keep a 2-metre distance and self-isolate and get tested if you have any symptoms. Doing all of this is tedious, it's hard, it's distressing, it's painful and increasingly so for all of us. But it is necessary to try as we hopefully approach this final stretch of this horrible pandemic, keep ourselves and our loved ones as safe as possible. So thank you for listening, and we will continue to update on any Four Nations discussions on this or on any other matters as we go through the days to come. But for now, I will hand over to Dr. Steedman, who will give us an update on the vaccination programme.
Thank you. So today I wanted to talk to you about 3 things: time, progress and patience. Has it really been a year? I asked myself that just yesterday. The first case of COVID was reported to the World Health Organization in December of 2019. And in many ways, it seems like such a short time ago. Time has flown. And in other ways, it seems really long. In the last 12 months, as you probably know, there have been more than 1.6 million deaths across the world from COVID. And the tiredness, certainly, that I have felt from so many people recently tells the tale of what seemed for some people to be really an endless year. But what a difference a week can make. And just over a week ago, we saw that we were able to deliver the first COVID-19 vaccine to protect us against the virus. And this is an absolutely tremendous, momentous turning point in a pandemic which has stripped so many of us of most of the joys of life. And I wanted to share with you a quote, which is one of my favourites from Martin Luther King, which is, "Out of the mountain of despair, a stone of hope." So just keep that in mind as I continue. And a year seems like a really good time to reflect on how far we've actually come in terms of the knowledge that we now have, the science, the developments, but also the pure resilience that we've all displayed in the face of this pandemic. And this has gotten us to where we are today, entering what we hope is a new phase in the pandemic and one of hope. Now, we know it isn't all plain sailing from here on. As we've explained before, and you're probably aware, this particular vaccine that we're using at the moment brings with it some real logistical challenges in terms of how we store it and how we transport it. But even despite all of that, we started delivering crucial vaccinations to our frontline health and social care workers last week and to those working and living in care homes this week, as we plan to do. So we've started, as we should clinically, with those most at risk from COVID. And as we continue to protect the most vulnerable in our society first and foremost, that has always been our way. And we'll work through society in terms of the vaccination in order of clinical need and as fast as we can, as more vaccine and indeed more vaccines become available to us. And now you'll all be able to see the progress that we're making. We've put in place a weekly reporting system with Public Health Scotland, who will include the COVID vaccine statistics in their weekly publication from next week. So that's from Wednesday, the 23rd of December. However, I'm absolutely delighted to already be able to say that since the programme began just last Tuesday, our management information system tells us that 18,644 people in total had received their first dose of the vaccine by the end of Sunday, the 13th of December. More than 18,000 people. That's a lot of stones of hope chipped off our mountain of despair already. Now, currently, we are still limited by the supply of the single vaccine that we have available and the understandable condition by our licensing body that we have to hold back 50% of the vaccine so that people can get the 2 doses that they need to be best protected. So I really do hope that you can all understand that it's going to take us some time to vaccinate everyone. And so we will need your patience. And we need your resilience a little while longer too. But believe me when I say that we are absolutely committed to vaccinating as many people as we possibly can and as soon as we can. Another stone of hope to hold on to is that we might be limited at the moment in terms of the amount of the Pfizer vaccine we have over the next few months. Production continues to scale up at pace. And in addition, we're really hopeful that there will be other vaccines available for us to use in the very near future. And all of this can accelerate our plans even further. In fact, we heard only today that Valneva is about to begin its first UK clinical trials for its promising COVID vaccine, and that's actually being developed in Livingston. So it's another really proud and a really hopeful moment for Scotland. Now, as someone who is herself waiting further down the prioritisation list for the vaccine, I do understand how difficult it is to wait without yet knowing when your turn will come. But we will all get there. The other hugely positive thing about the vaccine, of course, is how safe and effective it's been shown to be in the clinical trials, providing really quite an astonishing 95% efficacy against clinical disease with COVID. So it really will prevent people getting ill and dying from this virus. More progress obviously is needed. We still don't know yet whether the virus will stop people actually catching COVID or stop them transmitting it to other people. And we don't yet know how long any protection from the vaccine will actually last. And more evidence will come on this in time, and as more people are vaccinated, of course. But because we don't yet know these things, this brings me back again to patience. Everyone wants to know, now that the vaccine's here, when we can get back to normal life. When we can ease the restrictions that are part of keeping us all safe just now, and to allow us the human contact that we've all missed so very much, myself included. And that time will come, just not immediately. So we need you to stick with it for a little bit longer. How much longer depends on how many of our population we can vaccinate and how quickly, and of course the emerging evidence on whether the vaccines prevent actual transmission of the virus between people. So please, let's all continue to protect ourselves and each other in the best ways that we know. And that's by following facts until we know that it's safe to let our guard down in other ways. And I promise that we will do that as soon as we possibly can. So please think of this too over Christmas, as the First Minister has outlined. And please do all that you can over that period to keep yourself and all your loved ones safe. So I started with time, progress and patience, and I'm going to finish in reverse. Firstly, by thanking all of you for your patience so far. Please don't stop now. We believe we're nearly there. Remember all of the progress we have made and we continue to make. The rest will come in time. Vaccination is a game changer. The more people we can vaccinate, the faster we can do it, then the faster we will win the game. So if you're eligible for a vaccine and you're called, please take up the offer of the vaccine. More than 18,000 people already. That's a really amazing start to what we all hope and believe is the beginning of the end.
Thanks, Nicola. We'll move now to questions, and can I say thank you for being with us for a longer period than normal today, but I hope you agree we've had some important information to share with you. The first question today, though, comes from Glenn Campbell from the BBC.
Yeah, Hello, First Minister. I wonder if you can tell us, is this your last word on Christmas? Do you rule out further restrictions, or might the situation change if conditions worsen between now and Christmas itself?
Look, I've been very careful all along here to be straight with people that because we're dealing with an infectious virus, it would be, I think, wrong for somebody in my position to, on any day, on any issue, stand here and say this is the definitive last word, because we have to retain an ability to be flexible depending on how the virus develops. But Christmas is not very far away now. It's, just over a week away, and therefore the reason I'm standing here today setting out the ways in which I want people to interpret the rules that are in place is because I know people are already making plans, and I want to be giving people right now the advice that allows them to make the decisions that they are making for Christmas. So I hope very much that will be the case. Obviously, as I say, we're still discussing on a Four Nations basis a possible joint position, but I'm setting out clearly just now the sort of boundaries that the Scottish Government wants people to operate within. And just to be clear, the safest way to spend Christmas this year is in your own home with your own household. And if you can do that, that is my strong recommendation. And if you are having any interaction with other households, try and make that outdoors. But if you are meeting indoors, the rules and the guidance is keep the numbers as small as possible and keep the duration as small as possible, and follow all of the other mitigations about distancing, cleanliness, ventilation. One of the things I think it's really important to stress, and I understand that people may, and this is not the fault of people incidentally, this is the fault of those of us trying to communicate. They hear about a 5-day period of flexibility and they think, well, that means we can do what we like for 5 days. That is a window of opportunity. It doesn't mean I am saying if you think it is essential to meet up with others, it's okay to do it for 5 days. Choose your day within those 5 days if you absolutely must do it, and limit it as much as possible. So I'm going to, between now and Christmas, be as clear with people as I possibly can. This is not easy for anybody right now. I said in my opening remarks, it would be a lot easier if it was just binary. Some people say just ban it altogether. But if we do that, knowing that at Christmas there will be some people who feel they can't leave loved ones alone, would be leaving them without any guidance at all. And if we don't have any rules, then it's a free-for-all. So I'm trying to get the balance as right as possible here, and trying to communicate the guidance as clearly as I can with people. And I'll continue to do that every day between now and Christmas.
Should people cancel or scale back plans they may have made at an earlier stage in good faith because the circumstances are changing?
So I tried to set that out again. I cannot, and this has been, I cannot provide for everybody's individual circumstances. I know sometimes you will have heard me over the last 10 months and think that's exactly what I've been trying to do. I'm trying my best to give people advice that covers as many eventualities as possible. And of course, we do put some things in law that, everybody has to comply with. So I tried to say this: if you are somebody who hasn't made any plans to meet with other households at this stage with 9 days to go to Christmas, then my advice is don't do it. If you're still swithering, if you're kind of thinking, well, do or don't I, come down on the side of not doing it. If you have made plans and you think, do you know what, they're not essential, I could probably get away without doing that and maybe delay until later in the year when more of the population, particularly vulnerable people, might have been vaccinated, that's my advice. But if you feel that you really have to meet up with another household and you've made those plans, or you're about to make those plans, then I'm trying to give you as much guidance as possible about how to minimise the risks. So keep the numbers as small as possible, keep the duration as short as possible, and keep, if you can, keep it outdoors, and certainly any indoors portion of that as short as possible. And when you are indoors, remember, you should still try to keep a distance. You should still wash your hands and wash surfaces. That's more important if you're having people in your house for Christmas, and make sure you open the windows. So I know that's more nuanced than just saying don't do it or do what you like, but I'm trying and will try to give people as clear advice as possible. In Scotland, you heard me yesterday in Parliament putting more areas into level 3. We've got no areas right now in the very highest level of protection, but we do see cases increase again in some parts of the country. Our case numbers compared to England and Wales and to a lesser extent Northern Ireland, but nevertheless our case numbers are the lowest of all of the 4 nations right now, but we can't be complacent. This is a virus that is gripping the world, and therefore we have to take account of the situation we're in right now and act accordingly. And I'm trying to be as clear with people as I possibly can. Gordon, did you want to add, Nicola?
Just to say to people that I am worried about Christmas clinically. We know it's a time when there's a real risk of increased transmission. And you're absolutely right, our cases may be proportionately lowest in the UK, but they are not low, and they're not as low as either of us or anybody else would want them to be. Many hundreds of cases per day is too many, and these deaths are too many. So I am worried about it. We can only give people advice, we can only give them the best guidance possible, and people will make their own choices. But I would ask that everyone think very, very hard about those choices and how necessary they are. And just to finish by saying that every single day matters. What we do every single day matters.
Gordon Cree from STV.
Thank you. There has been for a while, and perhaps rightly, a stigma about breaking the rules. But with Christmas, where you have a situation where the official line is, well, you can do something, but we'd rather you didn't, is there a risk here that there becomes a stigma around doing something that's within the rules, and that people who do that will get the blame if there is a rise in cases in January? And can I ask Dr. Steedman, when we spoke last week, understandably, you couldn't put a date on when you thought everyone would be vaccinated by, but in terms of the capacity to do this, if there are the supplies, what capacity is there to do it by when?
I'll hand over to Nicola on those questions in a moment. I'll try to be a bit more brief than I was in response to Glenn. Take on your question about Christmas. I don't want there to be stigma attached to any of this. I don't want people to be blamed for any of this. I'm responsible, as First Minister, as head of the Scottish Government, I'm responsible for the policy we set, and I'm trying to get these decisions as right as possible. But if there's any criticism about whether they're going too far or not far enough, that should come to me, not to anybody else. It's just everybody is trying to navigate their way through this. Of course, I want people, and I think everybody has a personal responsibility to be responsible and to stick to the rules and the guidance as much as possible. And I've said that all along, but I don't sign up to blame or stigma. We're trying collectively to get through a horrendously difficult situation. And I've, like everybody does, I agonise and struggle over what's the right thing to do here. Yes, we could just say, look, nobody, and this is the law, nobody should meet with anybody else over Christmas. But I recognise that at Christmas, the vast majority of people will obey that, even if they hate it, because people are law-abiding. But over Christmas, more so than at other times of year, some people will think, well, I simply can't leave my elderly relative alone, and therefore I have to see them. And if we don't, if I just take a kind of head in the sand, well, I'm saying don't do it, we kind of leave people without boundaries around that. And so we risk actually making the situation worse rather than better. And that's the reason why we're trying to take a more balanced view right now. And there's no easy way through it. One of the things I get a huge, as you can imagine, number of emails and letters every day. I can't possibly read them all and certainly not reply to them all personally. But every night I try to read a cross-section of the emails that I get at all times, not just now, because it helps me understand what the public are thinking about the things I'm doing and deciding. And I did this as normal last night, and literally for every email I had saying ban Christmas visits altogether, I had another one setting out the difficulties to their mental health and well-being that would occur if I did that. And I think that illustrates that this is in an incredibly difficult year. This is possibly the most difficult period we've faced so far. I should say plenty faith groups have gone through this already this year and have coped, so we've got to bear that in mind as well. But we're trying to get this as clear as possible, and you'll hear me say this endlessly between now and Christmas Eve. If you can stay in your own house, in your own household this Christmas, that's my recommendation. That's the default position I am recommending to you. But I'm trying to recognise the circumstances that people feel they're in, and then putting as much safety mitigations around that as possible. And I think that is, in a difficult situation, the most responsible thing I can try to do. Nicola, do you want to talk a bit more about vaccine?
Yep. I'll just add from the clinical point of view, in terms of blaming people and stigmatising them for acting within a breadth of guidance. No one wants that, and we're not suggesting that should happen at all. The reason that breadth of guidance is there is to allow for the four harms, and to allow for the fact that some people, for their own health, for their own well-being, may need to meet with other people during that time, and we completely understand that. All of our lives are not the same, so we have to allow for that. Please don't judge other people, but what we are asking is those of us who don't have to do it to please think about not doing it, so that whatever impact those people who have to do it has will be the absolute minimum. So in terms of the vaccination, again, I'd love to be able to give you a magical date if in a magical world we had all of the doses of vaccine that we needed tomorrow. I can't do that. What I can tell you is that we're obviously aiming to potentially vaccinate around 4.5 million people with 2 doses of the vaccine, about 28 days apart. So that's a mammoth undertaking. And we now know as well from the MHRA that they need to have a 15-minute observation period for every person that has a dose of the vaccine, which means that we need to then factor that into the logistics as people come in and go out of clinics. So it isn't as straightforward as just lining people up and standing there with the doses. There's the preparation as well in terms of this particular vaccine, and all of that takes time. So if we had all of the vaccine that we needed for the whole population, we would still be in a position where it would take months. There's no doubt about that. And I think we would still definitely be looking towards spring at the very, very earliest. And that's if everything was lined up, which realistically is not necessarily likely to happen. And what I can say is that we have lined up the number of vaccinators that we predicted that we would need. And we also have other options for vaccinators. So we still have our volunteers, we still have our retired registered healthcare practitioner lists. We have lots of other board staff that we could mobilise if we were fortunate enough to get more vaccine. So we are as prepared as we possibly could be, but it's never going to be a matter of days to vaccinate 4.5 million people, even if we had all of the vaccine.
So taking account of all of that, though, we will vaccinate as quickly as the supplies allow us to do. So the biggest constraint on us being able to answer that question right now is the uncertainty about supply. Nicola's right to talk about all of these other complications, but we can factor all of those into our planning. The one uncertainty that we are not in control of is just the pace and the flow of supplies. Obviously, the group we want to vaccinate first and as quickly as these supplies allow is care home residents and staff, and that we were really pleased that we were able to get the flexibilities to allow that programme to begin this week. James Matthews from Sky.
Thanks, First Minister. Boris Johnson has said in the past few minutes that the four nations have agreed in principle to continue with the easing of Christmas restrictions. Does that chime with your understanding of where you are right now, or might you yet diverge? And also, the scientists could not be clearer. To use their words, or to use their word, are you being rash in easing restrictions over Christmas?
I've not heard what the Prime Minister said, obviously, because I've been standing here as he's been in the House of Commons. I'm not going to comment. Take what I said in my opening remarks as an articulation of my position, and I hope that position, as much of that as possible, will be agreed by the four nations. I said that for the reasons I set out, I didn't think it's sensible to take away all flexibility, but we wanted to put very clear guidance around how people should be advised to use that flexibility. I would hope that nobody who has listened to me over the past days and including today would think I'm being rash in any way. I'm trying to balance very difficult factors to reach the best decision I can. And I think, so look, one of the things that does trouble me, and I'm trying to rectify here, is the idea that a 5-day period of flexibility means that we are saying to people, for those 5 days you can do what you want within these limits. That's not what we're saying. It's a window of opportunity, a maximum, during which, if you must meet other people, here's what we recommend that you do to make that as safe as possible. And I'm very clearly saying, in my view, within that 5 days, if you have to meet with another household, don't do that any more than on one day. Keep the numbers as low as possible, keep the duration as short as possible. If you can do it outdoors, do it outdoors. So we're trying to make what people may do anyway as safe as possible, but be in no doubt that my central recommendation to people is, if at all possible, you should celebrate this Christmas in your own home, in your own household. That's the safest way for you and your loved ones. And that is my central recommendation to people. The fact that we are trying to put in place a framework to recognise that some people may do different things and to make that as not risk-free, because it's not risk-free, but to reduce the risk as much as possible, does not mean that we are not saying very clearly, stay at home in your own household if you possibly can. Tim Backshall from ITV Border.
Thank you, First Minister. As you've already said, a lot of people will be agonising now over what they should do over Christmas. And I appreciate you touched on this already, but I wonder what message you would have to those expat Scots who will be travelling home from other parts of the UK, may already have booked their journeys. Should they now think about cancelling? And just one other point, if there is a spike in January, will you still think that this policy of allowing this relaxation was the right one?
I think you can take for read that whatever happens over the course of this virus, I will probably spend the rest of my days agonising over whether things were the right things or the wrong things to do. I desperately wish these things were simpler and more binary, but I have to factor into all of our decisions. I wouldn't be doing my job responsibly if I didn't we're not living in some kind of laboratory right now. I have to factor in human emotions and human behaviour and human instincts, and try to factor all of that into the arrangements we come to, and that's what I'm trying to the best of my ability to do. On travel, I indicated earlier on that we will give some clear travel advice. I'm not speaking for the UK government here, so forgive me, and I hope they will forgive me if I'm straying into territory that they take a different view on. But my understanding is that the areas, London, for example, that has just gone into the highest level of protection in England, there may well be advice from the UK government that people should not travel in and out of these areas. So clearly, if that was the case, then that would apply to travelling to Scotland. But even if that's not the case, we will set out advice that if you're living in any of the nations in one of the highest levels of protection, which in England and London is Tier 3, then we don't think you should be travelling to other parts of the UK, because it is clearly an issue here about trying to avoid spreading the virus from high to low prevalence areas, and we will try to set out as much definition around that as possible. Obviously, Wales has got much higher levels of prevalence than we do right now, so that would probably also be a comment that was applicable to Wales. I know the First Minister of Wales is doing a press conference as we speak just now, and will be saying more about the situation in Wales. So these are difficult circumstances, but we must collectively try to stop the spread of the virus as much as possible. Lewis Mickey from Bauer.
Thank you, First Minister. People are being asked to limit contact with others ahead of easing of restrictions. There's even talk of asking people to self-isolate for 7 days before meeting up with families, but that won't be possible for many teachers in Scotland who will still be in the classroom next week. So what should they do to avoid missing out on time with their families at Christmas?
Let me be very clear here, that what I'm talking about is people should already now, if they are planning to meet up with others over Christmas, be reducing their unnecessary social contacts. I recognise that people, myself included, have to go to work to do essential work, and therefore people can't avoid that. When I'm talking here about reducing unnecessary social contact or social contact if you're planning to meet up, I've set out some of the work we've done around the risks in schools and why we think it is important to keep schools open. So I recognise that teachers have to be in school, just as nurses have to be in the wards, and just as many other essential workers have to be at their work, and we recognise the reality of that. But if you are, for example, in the habit just now of meeting up with a friend once a week for a coffee, don't do that this week or next week if you're planning to see other people over Christmas. These are the kind of things that we should not be doing if, and I stress, if we're planning to meet with other people over Christmas. As you'll keep hearing me saying, the safest thing to do is not meet up with other households over Christmas, but if you're planning to do that, then cut out social contacts between now and then as one of the ways in which you reduce the risk of that interaction. Okay. Shona Duthie from Original 106.
Thank you, First Minister. It's been recommended for a few weeks now that Aberdeen and Aberdeenshire should have been placed into a higher tier due to the rising number of cases. Why the delay until this week, given the impact it will have on businesses so close to Christmas? And also, you hinted yesterday that level 4 could be considered for some areas if infection rates continue to rise. What might warrant a move to level 4 for those areas?
I didn't hint yesterday. I set out clearly that if infection levels rise to a particular, steeply in any area, level 4, we've had level 4 in some areas. So I'm not hinting at things, I'm just setting out the reality, and I will only set out decisions when we have taken those decisions. Why did we not put Aberdeen into level 3 beforehand? Because we didn't think it was entirely merited. These are, when you put an area up a level, you're impacting businesses, individuals. We don't do it lightly, but we don't shy away from doing it if necessary. We believed in the last 2 to 3 weeks that Aberdeen may be able, with level 2 restrictions, to bring cases back under control, the city and the Shire. That has not proved to be the case, and therefore cases got to a level where we think level 3 restrictions are now necessary. Clearly, whatever decisions we take, and this is perfectly understandable, some people will agree with them, some people won't. This time last week I was being asked repeated questions about why we hadn't put the City of Edinburgh down a level. And as we now know, that would have been the wrong thing to do, because we've seen cases there rise steeply. So these are always balanced judgments. Do we always get them right? No, I've tried to be straight all along. We don't always get things right. I don't think anybody in a situation like this is ever always going to get these things right, but we are trying to reach the best decisions we can. And I think you can see in the data that more often than not, we're falling on the right side of these judgments rather than on the wrong side. That doesn't mean that will be 100% of the time, but I think more often than not, we are doing that because of the careful process we go through. Do you want to add anything?
Just to add that I hope that all of the local authorities would agree with us that there's an awful lot of evidence and thought and science and judgment that goes into every single one of these decisions and every single review point every week on this. It's not done lightly, as the First Minister says. We have published the indicators by which we measure boards, so the number of cases and the percentage positivity of cases, the projections, the hospital use, the ICU use, and all of those are broad indicators. So there is some warning, if you like, and some guide for local authorities to know where they might be headed. But even then, decisions are taken in the round, and not just by one person either. There's a national incident management team that look at all of the data with all of the directors of public health from the various boards. And then when they make their recommendations based on harm 1, in other words, the harm that comes from COVID itself, that goes to another group to then put it in the wider context of the 4 harms, and only then is a decision made. And that clearly has to be the right decision. It can't be based on a one-off measurement. It's of no use to anyone to escalate it up and down quickly, continuously between the different levels. So again, we also look at trends. So it's just to explain the complexity of the decision making, and it's really that we have to be sure at the time when we move a level that it is the right thing, and that means it takes time to be certain about that, bearing in mind all of those things that we need to take into account.
Neil Pooran from PA.
Thanks, First Minister. In terms of travel within Scotland, I know you touched on travel around the UK nations earlier on, and I know that the details are still being worked out, but what's your initial thoughts on travel between different local authority areas, for example? Is this something which you would consider putting into law, or rather keeping in law? And what exactly would you mean by travelling from high prevalence areas to low prevalence areas? Would people be able to go from an area that's one level higher to lower?
Well, so right now, the rule is in law that you don't travel outside, well, no areas in level 4 at the moment in Scotland, but if you live in a level 3 area, you don't travel outside your own local authority area, even to another level 3 area. And people in levels 0, 1 or 2 don't travel into a level 3 area unless that travel is essential. Over Christmas, the plan has been to enable people where they feel it essential to form a bubble, to travel between local authority areas for the purposes only of that bubble, not to travel for other purposes. And once you're in a bubble, not to then travel to another area. And we will set out very clearly the boundaries of that. And of course, as part of strengthening the guidance, we are looking at whether we want to tighten that any more in terms of travel between level 3 areas, for example. But we will set out very soon any further detail on that. But at the moment, over the Christmas period, the travel would only be for the purposes of a bubble. And remember, we are asking you only to form a bubble if you think that is absolutely necessary. So the default position is stay in your own home, in your own household, which means stay in your own local authority area. I know this is really difficult for people to understand, and we are trying to lay out this detail in as clear a way as possible, and we'll continue to do that in the days to come. Chris Musson from The Sun.
Hi, First Minister. You described the Protect Scotland app fault earlier as a one-off blip. Will you apologise for this, because this is likely to have caused many people significant upheaval? And can you explain a bit more about what you mean when you said the app was configured over-sensitively? I mean, does that mean it detected people as closer than they were? Was it overestimating the time people spent in close contact? And crucially, how will contact tracers now know which of these people should self-isolate? And secondly, just about your Public Health Minister, Joe Fitzpatrick, you'll be aware he's been facing criticism and calls to resign over the record levels of drug deaths, including his response last night on STV, where he didn't even know the number of rehab beds in Scotland. We've also not seen him here at any of these briefings since March, despite him being Public Health Minister, which begs the question about whether you have much confidence in him. So can I ask, are you confident Joe Fitzpatrick is the man to be overseeing the vaccine rollout?
I'll come on to that in a second. On the Protect Scotland app fault, of course I apologise for anything that goes wrong. Apologies if I didn't say that up front, but I hope people kind of take that as read. It was a mistake, a technical mistake that has been identified and fixed, and I'm standing here being upfront about it. So yes, I'm sorry that happened. I'm not a technical IT person, so I'm not going to try and explain exactly how it happened or exactly what the detail of that is. I will get a technical explanation to you for that. Everybody who has a smartphone knows that apps upgrade regularly, and this was an update of the app that threw something off kilter that meant people who should not have been notified were being notified, and that I think is something to do with an overly sensitive calculation of time and distance. But if I was to go any further on that, I'd be straying into the territory of IT specialists, and it probably would not help people for me to do that. The most important thing for me to say is, for those people who were notified in that time period, if you phone the contact tracing centre, they will tell you whether you should have been notified and should be self-isolating, or whether you don't have to and can stop that. And the other thing for me to reassure people about is that the problem was quickly identified, has been fixed. It was a blip, and we're being upfront about it rather than just leaving these people to self-isolate when they don't have to. So yes, I'm sorry it happened. I'm sorry that anything that goes wrong. Unfortunately, occasionally, particularly when we're dealing with technology, these things do happen. I think, Chris, you should take as read that any minister in my government is a minister I have confidence in. If I don't have confidence in a minister, then they will no longer be in my government. In terms of the vaccine rollout programme, the Health Secretary is overseeing the vaccine rollout programme, and as we demonstrate every single day, I am ultimately responsible for all aspects of COVID handling, management, and that includes the vaccine. The buck stops with me, as it does on any aspect of government policy. And, you know, I've taken the decision to do these briefings almost every day we've done them, because I think it's important that I take that responsibility and show that leadership, and the Health Secretary and other ministers and clinicians have joined me here. The drugs death issue is one we take hugely seriously, and I'll no doubt say more about this in the days to come. But every minister in my government is somebody that I, by definition, have confidence in. Rachel Watson from the Daily Mail.
Just to check, on the first question about the app, can you explain in simple terms how contact tracers will now know which of these 900 people should self-isolate?
Nicola, I think the problem here, Chris, is I'm not sure I can do it in simple terms, because they'll be able to look and see, because of the characteristics of the notification, whether it was a correct notification or not. It is highly technical. I am not going to try and give an explanation, but I have been assured when I first got told about this yesterday, one of the questions I had to get an answer to was, could they tell somebody who phoned up were they correctly or incorrectly notified? And I have been assured that that is the case, but the actual technicalities of what enables that to happen, I cannot stand here and give in simple layperson's term. I'm going to hand over to a clinician who's not an IT expert either, just in case that she might be able to.
I'll happily hold my hands up, but I can give a little bit more detail, which might help you, Chris. So first of all, just to be clear, it was to do with the time that someone had been in proximity to a confirmed case. That was much shorter than we would usually want from the app, which is 15 minutes, as you know, at less than 2 meters. So it was about the timing element. And I think the important thing to take away from that, which is not to excuse it, but it is to say that these people were in proximity with a confirmed case. So it's not that they weren't, it's just that they were in proximity for a much shorter period of time than we would normally expect the app to notify. There will be ways that the contact tracing team can narrow this down. For example, one of the ways is that we've very recently updated the app so that now it advises people to isolate for 10 days instead of 14, because the 4 CMOs changed the isolation guidance. And the timing of that actually coincides with the problem in the app. So there will be differences in terms of the messages that people have received for how long they need to isolate. And of course, it will be on a case-by-case basis. So people will go through what they have been doing during that time, whether it is likely that they had come in contact with a case, and an individual decision will be made. The other important thing about this is that clearly it's because the app is anonymous that we can't do it ourselves and just go and contact all these people, because we don't know centrally who has received the notifications. And that's the premise on which this app is based, and that's what gives people their privacy. Having said that, the First Minister has absolutely done the right thing, come out and disclosed this as we always would, and we will be treating this as an adverse event, and we will be further investigating it. We're not taking it lightly in any shape or form, but all the correct things have been put in place so that we can try to minimise the impact of this, and remember that this was in people who have had some contact with a confirmed case.
Derek Keeley from the Courier. Oh, no, sorry, Rachel Watson from the Daily Mail.
Thank you, First Minister. Today, Mark Drakeford has announced that on December 28th, Wales will go into a form of lockdown. People will be advised to stay at home, and non-essential shops will shut. Are you considering similar plans for Scotland in a bid to kind of lower the spread of the virus after the relaxation of the rules? Can you rule something out like that at the moment, and will there be an update before Christmas?
As you've heard me say before, it would be a foolish First Minister who stood here and ruled anything definitively out when we're dealing with a virus. That is not the same as ruling things in. there will be another review next week. I said that in Parliament yesterday. We hadn't been planning to do another review next week. We had intended yesterday's to be the last one before Christmas, unless there were exceptional circumstances, but we are doing one next week. We've also, I've asked the Parliamentary Business Minister to agree contingency arrangements with Parliament so that if there are any changes over the recess period, we have a way of notifying Parliament. So we will be monitoring the situation very carefully over Christmas, and if there are changes needed, then I will set them out clearly. I had in addition to the Four Nations call earlier this morning, I had an earlier morning phone conversation with Mark Drakeford, who advised me of what plans he was going to be setting out at his press conference at lunchtime today, which he obviously has now done. And you know, these are decisions he feels are appropriate given the circumstances in Wales. I would say that right now, of course, the situation in Wales is much, much more severe than in Scotland. So it would not be appropriate for me to announce similar things to those right now. Our situation would not warrant that. I can't look with certainty into the future and rule it out, but it's not the position right now. Case numbers in Wales are around 3 times what they are in Scotland. There is significant pressure on the NHS in Wales right now, so the First Minister there, rightly and responsibly, is responding to that. The situation in Scotland is different. We are not complacent about it, which is why we are encouraging everybody to continue to abide by the restrictions so that we can keep the situation, if at all possible, under control and avoid the need for those kinds of measures in the future. Derek Keeley from the Courier.
Thank you, First Minister. I've been speaking to Stephen Riker from St Andrews University. He believes there are lessons to be learned for Christmas from the spike in COVID infections and deaths following Thanksgiving in America. He has suggested the government should consider creating an extra public holiday, possibly in the summer, for people to celebrate an alternative Christmas, so they can have something to look forward to and more easily get on board with reducing their contacts this month. I was hoping to get your response to that, please, and whether that's something that's been considered at all.
Well, Stephen Riker is a member of our advisory group, obviously, and he's somebody whose advice has been hugely helpful and invaluable to us over the course of this pandemic. And I listen very carefully to everything he has to say. He's a voice of wisdom. I've not had the opportunity to consider that proposition in detail. You know, no doubt if it is being put forward as an idea, it is something we will consider. You know, clearly I've said today that people who can should consider postponing Christmas celebrations into later next year. Might feel a bit odd to celebrate Christmas in the spring or Easter, but to think about that. So, you know, giving people the ability to do it. I'm sure there are plenty of people, Stephen and others, who will argue for that. We will consider that in due course, but we haven't come to any considered view on it as of this moment in time. Simon Johnson from The Telegraph.
Good afternoon, First Minister. Mark Drakeford in his press conference has said his clear message to the Welsh people is that they should only come together in 2 households next week. You said your preference would be 2 rather than 3, and I just wondered if you could set out why you didn't formally reduce that limit from 3 to 2. I think I can understand why in terms of the notice and maybe the impact on longer term compliance, but I just wondered if you could spell that out for me. And secondly, just on travel, most of Scotland will be in level 3 when the Christmas bubble starts next week. Because the tiers between England and Scotland don't exactly correlate, what is the travel advice from level 3 areas to from the tier 1, 2 and 3 areas in England? Thank you.
So it's because the levels don't quite correlate that we're taking a bit of time to get that right, and we'll set that out in more detail later on. Level 3 in England is the highest level of protection there, more akin to our level 4. We don't have any areas in level 4 right now, and therefore we just need to make sure we're being clear about that. So that's why we're taking a little bit more time. Obviously, I haven't heard Mark Drakeford's press conference because it's been happening at the same time as this one. I did speak to him earlier on, and we've had the Four Nations call. My understanding, and if he has announced something different, then obviously what I'm about to say is wrong. But my understanding is he's not proposing changing the legal requirements around the 3 households, but is giving advice that 2 would be better, which is pretty identical to what I've already said today. The 3 is basically, families come in all shapes and sizes these days, and we're trying to recognise that, recognising that people might have made plans already. But the principle here, so if you think about this in kind of order of what I'm saying, don't do it at all if possible. Stay in your own household. If you feel you must, the smaller the better. So the 3 is the absolute maximum, 3 households. And in Scotland, unlike in the other countries, we've also said there should be a upper cap of 8 people within that. That's the maximum. Keep it as small within that as you possibly can. 2 is better than 3, just as 1 is better than 2. So small, the smaller the Christmas you have, the safer the Christmas. The shorter you spend with other families, the safer the Christmas. And the safest way of doing it is staying within your own home, in your own household.
The fact there's only a week to go until this happens, and also, you know, that maybe people's plans may be set in stone, and you didn't want people to start breaking the rules. Was that a factor in your decision as well?
These are all factors. I think I said that explicitly in my opening remarks. So the fact that, you know, some people will just feel they can't leave loved ones alone. The fact that some people will have made plans, and we want to try and recognise all of this within those boundaries that we're setting. So these are all factors that we're trying to take into account. But to simplify this again, you know, my advice to people is to, as far as possible, stay at home in your own household. And then if you feel you have to work out from that, to do it as little as possible, with as few people, for as short a duration as possible, with all of the protections that you can wrap around that. And I will set this out every single day as clearly as I possibly can for people, recognising that everybody's got to make their own detailed judgments within that. But what I need to do is try to be as clear as possible in what I'm recommending and not recommending to people. Mark McLaughlin from The Times.
Good afternoon, First Minister. Can I just check something on the priorities of the vaccine? So in England, they vaccinated care home residents and also some 80-year-olds in the community, whereas in Scotland we appear to just be focusing on care home residents in line with the JCVI guidance. So was this a policy decision, a difference in policy between Scotland and England? And is England maybe spreading their allocation of the vaccine more thin, whereas we're just pouring them all into care homes? And I just want to clarify something you said earlier. You said that teachers have a lower risk of severe COVID than the general population. Is that just another way of saying that pensioners don't work in schools, or is there some other variable?
That's certainly not what I was trying to say. And just to be clear, I didn't say it. I was quoting a report by Public Health Scotland that says it, but the report's there for you to see. It's quite a detailed and statistical report, and if you've got detailed questions like that, once you've had the chance to read it, then we'll take them and answer it. On your first point, I'm going to hand over substantially to Nicola on this, actually. I'm not going to comment on what England is doing. One of the things, so care home residents have that high priority from the JCVI, that's true UK-wide, but there are particular difficulties in getting this vaccine because of its characteristics around temperature and storage and the limitations in packing down the pack sizes that make it very difficult to get to care homes. We have worked with the MHRA to agree a deployment model that is allowing us to get it into care homes, and it may be that is slightly different in England, which is leading them to make other judgments. But our priority is to get care home residents vaccinated as that priority as quickly as possible. But I'll hand over to Nicola to give a bit more detail on that.
Yes, so just to be clear, in terms of clinical prioritisation, the first group on the JCVI list for very obvious clinical reasons are care home residents in homes for older adults and their associated carers. And then the next on the prioritisation list are frontline health and social care workers, so patient-facing health and social care workers, and also 80-year-olds and above, because age is by far the biggest risk factor in terms of harm from COVID. So I think across the UK, we are all concentrating on those top two groups, if you like. And the important thing to realise, of course, between Scotland and England is that because health is devolved, our health structures are different. This means that there are different legal restrictions on both of us in terms of what we are able to do in how we pack the vaccine down. So, for example, we've found a way of being able to do it using our health boards, which allows then our health boards to go out to care homes and administer it. And we're absolutely delighted that we've been able to do that and protect the most vulnerable people. In England, they have something called primary care networks, which are different, and that allows them legally to be able to take large quantities of the vaccine out to big primary care networks where they can then be able to give people vaccines from there. In Scotland, each of our primary care practices is a different legal entity, and therefore we can't actually legally or in the regulatory fashion pack down the vaccine into small enough amounts to be able to take it out to any general practice at this stage. So it's really to do with regulatory and legal differences across the nations in terms of how we're doing this. But just to be clear, those top 2 JCVI prioritisation groups, care homes, health and social care workers and the over 80s, we are all across the UK concentrating on those in the first wave of vaccination, as we should do.
Quickly,
yeah.
Mark.
Parliament makes the law and the regulations. Why don't you just change the regulations if this is the obstacle?
So I think Nicola can correct me if I'm wrong here, but we're doing it the way we think is our preferred way of doing it, which is doing care homes first, and the legal structure of our health boards enable us to do that in a way that I understand may not be as straightforward in England. So we're actually doing it the way we would choose to do it, which is going into care homes first, care homes for the elderly first. So it's not that we're having to do it in a second best way. We're doing it in the way we want to do it. Care home residents are the top of that priority list. So there's no argument that says we should change those regulations.
Absolutely. And some of this is based on MHRA agreements. And of course, MHRA is our UK regulatory body. So that is the body that gives advice for the whole of the UK. And it's just that our structures then are different in the different parts of the UK. And we have to remember, of course, that at the moment this is only an issue because the Pfizer vaccine comes in such large quantities and has to be stored at -70 and is difficult to transport. When either the Pfizer vaccine comes in smaller packages or hopefully soon other vaccines come in that don't have those requirements and don't come in these large packages that need to be diluted, then it will be completely different, and we will be able to get those in Scotland to GPs in the same ways we do with all other vaccinations. So this part of it is just a peculiarity of the way at the moment the Pfizer vaccine is manufactured. And we've been able to work with that, which is the most important thing, to protect those people right at the top of the list. And that's all we want to do.
Scott McNabb from the Scotsman.
Thank you, First Minister. Just to go back to your opening remarks when you alluded to the report published today and the impact of COVID in schools, suggesting around 2/3 had not had any COVID pupil infection. You may be aware that the EIS have issued a briefing today, a survey of around 1,900 teachers setting out widespread concerns about COVID safety in schools, areas like ventilation, social distancing and the wearing of masks. But they also point to the recording of cases not being done properly. I'm just wondering then, does that give you concerns about the robustness of the report published today, and what's your response to this EIS report? Thank you.
I've not seen the particular points about the concern about cases being recorded. I would, I have to say, as a starting point, have confidence in the robustness of the Public Health Scotland data, because they will, be very robust in how they gather that data. It's a very detailed and technical report. So the numbers that I've given, and people can go and look at them. I have confidence in. Obviously, we will look at any concerns that are raised, and I will, look at that, or have Public Health Scotland look at that particular concern and come back to you with a detailed answer to that later on. More widely, the fact that teachers have concerns about arrangements in school does not negate the figures I've given, and nor do the figures negate the fact that teachers have concerns. We have to work to address those concerns, either to reassure teachers in cases where the concerns are not merited or where the concerns are merited, take action to address them. And actually doing this work is part of that process. So it is about, in part, giving teachers the statistical information that show whether they are or are not at any greater risk from COVID or of being in school. So this is a really important part of that reassurance work.
Just to add to that, really, it's exactly why we do surveillance in schools. So it's not just testing that we do, it's regular surveillance that is underway. And it's precisely because we know that teachers have concerns. And the studies that have been published so far, in that sense, are immensely reassuring. And I completely understand those concerns, because any of us who are public-facing in our jobs, in our essential work, of course worry about our risk of COVID in doing our job. That's completely natural, and it's our job then to provide the evidence that shows that we are taking that seriously and demonstrates whether there is or isn't an increased risk. And certainly the class surveillance, which is antibody surveillance in teachers, as the First Minister said, has shown the same level of antibodies in teachers as in the rest of the general population. So no suggestion that teachers are getting COVID more. And that's been backed up as well across the UK by the ONS survey, which goes in and does regular swabbing of the population. So all these are really reassuring. But the other thing that we have done in Scotland is we have put in place so that teachers can have a test if they're concerned. That's one of the things that the Deputy First Minister was very keen to put in place, and we have put that in place. So I think the question of tests not being recorded or tests not being done, I would not think that's an issue in Scotland, because we've made it so that any teacher who wants a test because they are worried can get one. And every single test that's done in Scotland, whether it's in a school, whether it's a pupil, whether it's a teacher, is recorded nationally and reported. So, like you, First Minister, I'm confident in our surveillance and our reporting, and that doesn't play down the concerns of teachers, which we take very seriously.
We're also working on plans which will start to be implemented in the new year for asymptomatic testing in schools, which will be another layer of protection and assurance, we hope. But the DFM will set out more detail on that in due course. Alistair Grant from the Herald.
Hi there, First Minister. Thanks very much. Just on the issue of strengthening guidance, and apologies if this has maybe been touched on, but should people avoid Christmas dinners entirely? Would that be something that you would advise, given if they plan to meet up, given the unavoidable close proximity of gathering around a table? And you've also said that you hope there will be a four nations approach to the Christmas guidance. Is there disagreement at the moment between the four nations when it comes to strengthening that guidance and what should be recommended? Is that why talks have gone over 2 days? And do you have any regrets around telling people that the rules will be relaxed over Christmas and potentially getting into a situation where, as you touched on, it's perhaps unfair to start changing the rules last minute?
There's no fundamental disagreements between the four nations. Well, as is often the case, we'll have different nuances that we want to stress, maybe different language we prefer using. I don't think there's any fundamental disagreement here. But we've recognised that different nations may go a bit further on different things. But hopefully we'll be able to agree a joint statement later today. And on your question about Christmas dinners, I suppose if you see this as a bit of a hierarchy, and I know that's not it's much easier for me to stand here and say don't do something or do something, but life is not always that simple. So we're trying to give a hierarchy. My default advice, so the strongest recommendation I will give, is stay in your own house, in your own household for Christmas this year, because that's the safest thing to do. If you want to, or feel you need to see people from other households, my recommendation would be, if you can, go for a walk outdoors, or sit in the garden for half an hour. Probably on the 25th of December you won't be able to do it for much more than half an hour, and keep it outdoors rather than an indoors dinner. But if you feel that you have to see somebody on Christmas, if that person is maybe in a position where they can't be outdoors and you have to be indoors, keep the duration as short as possible, keep the number of people as low as possible, make sure the windows are open. make sure you're keeping distance as far as, the circumstances allow. Make sure you're washing your hands and hard surfaces. Don't have people eating out of the same dishes. These are all mitigations that people can take if they must be in these situations to reduce the risk. The risk is not zero and will not be zero, but we're trying to tell people how to reduce the risk as much as possible. Do I regret, as I've said before, and please, I'm not saying this to engender any sympathy, this is my job. I agonise over all of these decisions, and I think, almost whatever side I come down on in these issues, I will wonder if I've done the right thing. So, take this from the other side, and we'd said, no, we're not easing anything at all over Christmas. The rules stay the same. You can't go into anybody else's house. In my heart of hearts, I know the majority will always try and live by the rules, but in my heart of hearts, I know at Christmas that there will be some people who just felt they couldn't stick to that. And so what I'd have been doing is leaving them to decide what the boundaries and what the safety arrangements were. So I would probably be standing here right now agonising over whether that was the right thing to do as well. There's no perfect answer in any of this, unfortunately. I'm doing my best, everybody's doing their best, and I'm going to continue to try to get those messages across to people as firmly and as clearly as I can. Do you want to add anything?
Just to add that, as you can probably tell by looking at me, I love Christmas dinner as much as anybody else, and probably more than some, but as a scientist and as a clinician, if you look at it in its bare facts, it's risky. It's indoors, it's involving food, potentially with people sharing things. It's multiple people. It may not be ventilated well inside your home, and it may take quite a long time if it's anything like my usual Christmas dinners. So that's the science. But we also know there's emotion attached to that. All we can do is tell people the truth. All we can do is give people guidance, and people will make an informed decision. And that's what we're here to do.
Anecdotally, and this is anecdotal, so there's no science behind this, but based on people who contact me, I think the vast majority of people are planning to spend Christmas in their own home with their own household this year. Most people are not particularly relishing that prospect and not loving it, but most people, I think, are planning to do that, and that's, I would encourage that. But I think we all also recognise that people's individual circumstances differ, and therefore we're trying to give as clear, straight, honest advice to people for those different circumstances as we possibly can.
My own mum, for what it's worth, has told me that we're not spending Christmas together this year. So I didn't even have to broach it. She told me that it wasn't worth the risk.
And I'm just hoping and assuming that that's only because of COVID and not any other family dynamic.
I couldn't possibly say.
Anyway, Richard Percival from the Daily Express is the last question.
Thank you, First Minister. The UK government's travel task officer, Peter Hendy, told the House of Commons Select Committee this morning he suggested people should stay local and book public transport early amid fears of a Christmas travel chaos, as they put it. What would your advice be to people travelling on public transport on, say, December 23rd, 24th? And do you agree with Sir Peter Hendy's comments? I just wanted to clarify, can you confirm whether there'll be a change in enforcement during the 5-day period for people travelling into Scotland from the parts of the country, for example? Thanks.
I've already said we'll set out fine details of the travel advice shortly, but I've not seen the comments you refer to, so I know I'm frequently asked to comment on comments that have happened while I've been standing here, and I try not to say I agree or disagree with comments that I'm only getting a report of and haven't seen, so I'm not going to go into detail. But generally my advice is stay local. Stay in your own home and stay local, and don't travel if you can avoid it. If you have to travel on public transport, then book ahead, recognise and understand that there will be limited capacity because all of the physical distancing and everything will be in place, and therefore you should take all of that into account. That concludes the questions today. We've gone over our normal allotted time today, so if you've managed to stay with us, thank you for that. We had a lot of important ground to cover today, and I appreciate your patience. Thanks to Anna, because when we go on for so long, the person who bears the biggest brunt of this is always our BSL interpreter. So thank you, Anna, for bearing with us today. Thanks to the journalists and to Nicola for helping me with the answers to the questions. And thanks to all of you not just those of you joining us, but the whole population for continuing in the main to stick with this. It's really difficult. I think the next couple of weeks as we go into a period where we all usually love mingling and spending time with others, seeing loved ones, is going to be really difficult. And I think we all just need to think about what we need to do to get through this period as safely as possible, and we'll try to help you with that as much as we possibly can by being as clear and frank, even if it's not always what you want to hear. And encourage everybody, as Nicola did today, to hold on to that hope that by the time next year comes around, we'll be all looking forward to a much more normal Christmas, because this will all have started to become just a bad memory. We're on the path to that now, but we've got a difficult period still to get through, and that's why all of these restrictions remain necessary. All of what I've said today about Christmas, we will encapsulate that in updated guidance, hopefully later today, and hopefully that will be shared by the Four Nations, but we'll make sure that anything the Scottish Government is advising, you can access that in black and white on the website so that you know exactly what we are recommending and not recommending. But thank you for everything you continue to do. I'll see you tomorrow from the Scottish Parliament at 12:20. I'll give the daily update there, and then there will be the weekly session of First Minister's Questions. So thank you very much indeed for joining us.